What is hypoparathyroidism? Hypoparathyroidism means your body doesn't have enough parathyroid hormone. PTH is made in your parathyroid glands, 4 pea-sized lobes in your neck. PTH controls calcium, so you'll likely have low levels. If your calcium gets too low, PTH triggers the release of calcium from your bones. And it also raises the amount of calcium your body absorbs from your kidneys and intestine, too. Your body uses calcium to keep your nerves, muscles, and heart working. Without PTH, the lower levels of calcium can cause serious muscle spasms, tingling, heart problems, or seizures. Treatment makes sure your body has enough calcium and other vitamins and minerals. You can also eat a balanced diet, take supplements, and keep an eye on your diet. If you stick with your treatment plan, you can lead a full, active life with hypoparathyroidism. Hypoparathyroidism versus hypothyroidism. Your parathyroid glands use PTH to balance calcium, but your thyroid gland makes thyroid hormone to control metabolism, body temperature, and energy levels. Hypothyroidism happens when your thyroid stops working, also called an underactive thyroid. Hypoparathyroidism causes. Several things can trigger hypoparathyroidism, like injury or removal of thyroid or parathyroid glands during surgery, autoimmune diseases, Addison's disease, radiation therapy to your neck or head, low levels of magnesium, hereditary conditions. Hypoparathyroidism symptoms. If your calcium levels are slightly low, you may not notice symptoms at first. But for some, the symptoms can be life-threatening if calcium levels drop too low. Your hypoparathyroidism symptoms depend on how low your calcium gets and how long it's been low. If your calcium drops quickly, you may get serious signs of muscle spasms, including muscle cramps or spasms in your legs, feet, lower back, or face, tingling in your fingers, toes, or lips, anxiety and depression, heart failure, an irregular heartbeat, low blood pressure, seizures. These symptoms can range from mild to serious. You may also feel fatigue, too. If you have any cramp-like spasms from low calcium, get medical help right away. Although many symptoms are the same, some differ with persistently low calcium. If your low calcium goes untreated in the long term, your risk can increase for eye disease like cataracts, dental problems, calcium deposits in the brain that cause dementia or movement disorders like tremors or Parkinson's, hair loss and brittle nails, dry, puffy skin, bone disease. Persistently low calcium in children can have different symptoms. It may be caused by genetic syndromes like DeGeorge syndrome, or perhaps they have a genetic mutation that interrupts how PTH is made. Your child may have a higher risk for osteosclerosis or thicker bones, too. You may also notice poor growth or slower mental development, and your child can have dental problems like cavities or their teeth may come in later. Hypoparathyroidism diagnosis. You may get a hypoparathyroidism diagnosis once your doctor runs blood tests. They'll check to make sure your calcium is low. Because calcium ties to other substances in your body, they'll also test for albumin, PTH, magnesium, phosphorus, creatinine, vitamin D alkaline phosphatase. Your creatinine and alkaline phosphatase levels will likely be in range. Creatinine helps your doctor watch how your kidneys are doing, and alkaline phosphatase helps them look at your bone health. If these get out of range, your doctor may test your urine to see why your calcium is low. And if they suspect kidney or bone problems, they'll likely do more testing. If you have hypoparathyroidism, you'll probably have high phosphorus, normal magnesium, and low or normal vitamin D, and your calcium and PTH will remain low unless treated. Questions to ask your doctor. What caused my hypoparathyroidism? Do I need any more tests? How often will I need to see a doctor? What kind of treatments can help? Which do you recommend? How can I keep my calcium levels normal? What kind of lifestyle changes do I need to make? Will it ever go away? Will my children get hypoparathyroidism? If your child has the disease, ask their doctor how you can make sure they get the nutrients they need to grow. Hypoparathyroidism treatment. You'll probably start taking oral calcium and vitamin D to keep your hypoparathyroidism in check. You'll likely need lifelong treatment for your condition. The goal for your treatment is to make sure your body has enough calcium. And you'll need to avoid high phosphorus levels in your blood and too much calcium in your urine, too. High levels of calcium in your urine can raise your risk for kidney stones or other problems. It's also a sign that your treatment may be causing some harm. If your treatment is causing high urinary calcium, your doctor may change it. Your vitamin D supplement is an active form, called calcitriol in the US, but in other countries, your doctor may use alpha-calcidol. Or if you have chronic kidney disease, you'll likely get dihydrotachosterol. Your doctor will also prescribe a calcium supplement like calcium carbonate or calcium citrate. Your doctor will order regular blood and urine tests, too. These will measure your calcium, phosphorus, kidney function, vitamin D. If you don't have symptoms or they're very mild, you may be able to keep your calcium levels up through diet and supplements. You'll eat a balanced diet and take calcium and vitamin D. If normal calcium levels in your body are hard to maintain, you may need synthetic PTH. Paliperidoside is a PTH-based therapy you'll inject under your skin. Some doctors may also suggest using an off-label synthetic PTH called TERARATE. This PTH-based therapy has been used for other conditions, too. If your calcium drops too low, it can be serious. You can get life-threatening but treatable symptoms like seizures or spasms in your throat, hands, and feet. You'll likely get an electrocardiogram to monitor your heart. You'll also get IV calcium plus your oral vitamin D supplement. Taking care of yourself. Hypoparathyroidism requires treatment, but you can improve your well-being with a few simple lifestyle changes. Treatment aims to raise your calcium levels, relieve symptoms, and prevent kidney stones. But you'll want to keep your phosphorus levels in check, too. Here are some tips. Drink plenty of water. This helps keep your muscles and body hydrated. It also helps balance calcium levels. Aim for 6 to 8 glasses each day. But bottled water can contain calcium. Check the label. Exercise regularly. Physical activity keeps your bones strong and helps ward off fractures. Ask your doctor about what kinds of exercise are right for you. Pay attention to what you eat. Hypoparathyroidism can cause you to have too little calcium but too much phosphorus. Because of this, try to track how much of these nutrients you eat each day. Ask your doctor about foods high in calcium. You'll want to keep your levels stable, including watching your dairy products like milk or cheese, beans, tofu, nuts, especially almonds, dark leafy greens, broccoli, fish with soft bones. Some juices, breads, and cereals also have calcium added to them. If possible, try to get most of your calcium through food instead of supplements. Your body absorbs it better that way. Avoid foods high in phosphorus. It's also called phosphates or phosphoric acid in the ingredient list. These include fizzy drinks, processed foods, red meat, poultry, fish, dairy, hard cheeses, nuts, whole grains like rice, oats, and bread. Some vegetables. Some foods are high in both calcium and phosphorus, like dairy. Ask your doctor or nutritionist to help you figure out what's right for you. Take supplements. You'll likely take calcium and vitamin D supplements. Vitamin D helps your body get more calcium from food. It also helps get rid of phosphorus. You might also need a magnesium supplement if you have low magnesium levels. The doctor can tell you how much of each supplement to take. Some supplements, like calcium, work better if you take them with food. Stay in touch with your doctor. Hypoparathyroidism can affect the whole body, especially your kidneys and bones. Your doctor can keep an eye on these organs with regular blood tests and bone density scans. See your dentist regularly. Too little calcium can hurt your teeth. You can get more cavities or other dental problems. What to expect? Getting enough calcium and vitamin D keeps your hypoparathyroidism under control. See your doctor regularly. They'll monitor your condition and do blood tests. If you don't take your daily supplement and watch your diet, this dangerous condition can be life-threatening. How your condition might change over time. You may have had hypoparathyroidism for years and didn't know about it until it was found during routine blood work. Many people have few symptoms or mild symptoms, especially at first. Everyone can get different signs because calcium levels move up and down. But the longer you have hypoparathyroidism, the better you'll get at knowing the symptoms. As your condition changes, your symptoms can change, too. You may experience things like muscle cramps, tingling in your lips, fingers, and toes, fatigue, muscle spasms. If you don't treat your hypoparathyroidism, it can lead to more serious problems like seizures, throat spasms, or heart failure. But with calcium and vitamin D supplements, you'll likely feel better. If supplements aren't working for you, your doctor might suggest a synthetic PTH. Paliperidine or teriparatide can keep your calcium levels stable. Getting support. For more information, visit the website of the Hypoparathyroidism Association. You can also check out the National Organization for Rare Disorders or Parathyroid UK. Takeaways. Hypoparathyroidism is a rare disease where your parathyroid glands stop making parathyroid hormone. Symptoms can vary from mild to life-threatening muscle spasms and seizures, if untreated. Calcium and vitamin D treat this potentially lifelong medical condition, but PTH-based therapies and low-phosphorus diets can also help. Hypoparathyroidism FAQs. Can you gain weight with hypoparathyroidism? Gaining weight is not a common symptom when you have hypoparathyroidism. Common symptoms of hypoparathyroidism include fatigue, muscle cramps, and tingling in the fingers, toes, and lips. What organ does hypoparathyroidism affect? Hypoparathyroidism affects the parathyroid glands, two pea-sized lobes on each side of your neck. They make parathyroid hormone to keep your calcium in check. With hypoparathyroidism, you can have low levels of calcium in your blood. The drop in calcium can affect many organs including the kidneys, brain, heart, and muscles. This can lead to kidney stones and kidney failure. Low calcium can also cause headaches and memory loss. It can lead to problems with your heart rate and muscle pain, too. What age does hypoparathyroidism start? Hypoparathyroidism can start at any age. The condition may be present from birth if the parathyroid glands are missing. Because your calcium can drop slowly, the symptoms can be mild. It may take years before you are diagnosed. It's often discovered when a blood test shows low calcium levels, usually when you're 45 or older. And although hypoparathyroidism is very rare, 3/4 of cases are women. Which autoimmune disease is associated with hypoparathyroidism? Autoimmune polyglandular syndrome type 1 is an autoimmune disease where your immune system attacks your parathyroid glands by mistake. This causes them to stop making PTH. Symptoms usually start in childhood and include yeast infections all over the body, skin rashes, hair loss, chronic diarrhea or constipation. It's treated with medication to help stop the immune system attacking your body and ease symptoms. A team of specialists usually work together because it affects many body systems. What happens if hypoparathyroidism is left untreated? If you don't treat hypoparathyroidism, symptoms can be serious, even life-threatening. Very low levels of calcium can cause seizures, muscle spasms in your throat that can make it hard to breathe, or congestive heart failure. Can you reverse hypoparathyroidism? There's no cure for hypoparathyroidism and lifelong treatment is needed. But you can take supplements and medications to ease your symptoms. Treatments help get your calcium and phosphorus levels back to normal. What are the long-term effects of hypoparathyroidism? Over time, hypoparathyroidism can lead to serious issues, including cataracts, calcium deposits in the brain, kidney problems such as kidney stones or kidney failure. In children, it can lead to dental issues, poor growth, and delayed mental development. Treating your low calcium levels can help prevent these issues. Talk to your doctor about your best treatment options. What is the drug of choice for hypoparathyroidism? The main treatment for hypoparathyroidism includes calcium and vitamin D supplements. The goal is to raise your calcium level. You'll take an active form of vitamin D to help your body absorb calcium. You'll take these for life. If supplements alone don't work, you may be asked to take parathyroid hormone-based therapy. Paliperidine or teriparatide injections can help balance your calcium levels again. Your doctor may also suggest a diet low in phosphorus and to watch how much calcium you eat each day.